David Livermore now. He's a Professor of Medical Microbiology at the University of East Anglia. Thank you very much for joining us, David.
My pleasure.
There's a question that always hovers in the air for me in all of this, as we see our medical fraternity desperately scrambling, never to allow us to contemplate whether or not they might have handled this wrongly. You know, it's well, the lockdowns are obviously right, but perhaps we should have done it a little earlier. That seems to be the only debate they're willing to brook here. My question that always hangs around in the top of my curious little mind is, would it have been better if nobody had done anything? If we'd just allowed COVID to run its course? It was not the most lethal of viruses. And you just wonder, with all of Patrick Vallance and Chris Whitty, and next slide, please, and locking the nation down, irreparably damaging it economically for the foreseeable future. We're not going to get over the effects of these lockdowns, probably for decades. You just sometimes think maybe it would have been better if we'd have shut Vallance, Whitty and the whole gang down and done nothing.
I personally would have gone for something a little bit more intermediate between what we did and do nothing. I think Sweden more or less had it right. But to give you an example, Belarus followed your do nothing approach, and Belarus doesn't appear to have suffered any tremendous catastrophe with COVID as a result. We, on the other hand, have got £8,000 debt per person, £500 billion of total debt from the pandemic, mental health damage, educational damage, people lost their connection with work. On balance, it would have been better to have done nothing than to do what we did, though I do think something intermediate along the Swedish line would have been better still.
I mean, constantly we heard during the pandemic about following the science as if there is just one lot of science out there and there's no dispute in science. There's never any discussion as to, you know, what is true and what isn't. And it's, you know, there's no constant investigation. It strikes me that though we did know something a little bit, at least, about coronaviruses because they make up a lot of the common cold. Do you think that there is in that regard the science, and was it being followed, or were our scrambling to develop vaccines against a virus and trying to prevent something highly communicable from not being communicated at all, just whistling in the wind?
Science is always a work in progress. All the time, data builds, you change your opinions. What was wrong here was that we adopted a didactic the science to which no challenge would be brooked. So face masks were demanded on penalty of fines multiplying up to several £1,000s if you were caught not wearing one multiple times. And yet the evidence for face masks was scant in the extreme. And as the subsequent Cochrane review has shown, really, there's no good evidence at all for them as a prevention of respiratory viruses. So the science that was followed was actually more like a religion than true science, but it was a science that was very much forced upon people as if it was absolute truth. So I say it was handled more like a religion than a science.
Well, David, let me ask you this then. What do you think? I think the problem with this inquiry are its terms of reference, its remit, its limitations. It is not sitting to decide what I think is the crucial and essential question, is should we have locked down? Do lockdowns work? OK, technically that's two questions. But those are the questions. The fact that the COVID inquiry is not even going to consider whether lockdowns are the right way to go about virus crises, I think is ridiculous. The only thing they're going to consider is, did we lock down early enough and did we lock down long enough? Well, look at Sweden. Surely the question is, should we have locked down at all? And should we ever do it again? Am I not right?
Yes, I agree with you completely. Sweden did not lock down, and as I've said already, they've ended up with less societal damage, they've ended up with less debt per person, and they now have the lowest excess death rate across the past 3 years of any country in Europe. They've done far better than us. As for locking down earlier, the example is the Czech Republic. The Czech Republic did lock down early. They had relatively few deaths in the spring of 2020, but what then happened was they had a whacking big spike of deaths in the winter of 2020-21, and they've ended up with among the highest death rates from COVID across all Europe. So the notion that we should have locked down a few days earlier is nonsense. I don't think Sir Patrick actually understands the definition of the word bamboozled, but what he's now trying to do here is to bamboozle everybody at the inquiry and everybody who hears him speak into thinking that locking down somewhat earlier would have done good. It wouldn't. It might have delayed a few deaths, but they'd have still come in the autumn, just as or the winter, just as in the Czech Republic.